Another reason you may be experiencing knee pain when you squat is because you're squatting through too much range of motion. You're going too deep into the squat. So this can be problematic for a number of reasons. Not everybody can squat all the way down. Sometimes this is referred to as ass to grass, basically meaning you're gonna put your butt all the way down. So you're coming down all the way like this and coming all the way back up. Now, doing that as a body weight movement versus loaded up with a barbell or dumbbells or whatever, two very different things, okay? Not everybody can squat like that body weight, and even fewer people are gonna do that when under load. So if somebody's telling you you have to squat that way, they're an idiot, and no, you don't. What you need to find is the right range of motion for your body, understanding that it's gonna be very different than other people's, and then it's probably going to change over time, because ankle mobility can limit your squat, hip mobility can limit your squat, core stability or lack thereof can limit your squat, even sort of flexibility and mobility through your upper back can limit your squat. So a lot of things go into contributing why people can and cannot squat all the way down. The type of squat you perform also matters too and will contribute. So the key is, when it comes to depth, it's highly variable. And it's highly variable for reasons that are also out of your control. But the key is, do not force depth. Do not force range of motion. Find what works for you right now and work within that. Knowing that you may squat deeper with good technique in time, but you have to earn that. Just forcing the body to go into a position it does not want to go into is never going to help you get where you want to go. So one of the reasons squat depth is so variable from person to person has to do with our skeleton. Something that we cannot fix or change or do anything with. We have to work with whatever we have. So the key here, and I'm gonna go a little bit, I'm gonna give you the nerd alert right now. We're gonna go into a little bit of anatomy, but I'll keep it basic just so you get the basic idea of why forcing yourself to squat deep may not be a good idea. So your thigh bone, also known as your femur, at the top of it, it angles in like this way, where it meets up with the socket in the hip bone. Well, this angle right here is different for different people. So it could be more of a 90-degree angle. It could maybe be, open up and be more like 130, 135 degrees. So that is gonna be different person to person. You have no control over that. You cannot fix that. Also, the position of the socket, right? So it could be more towards the outside. It could be more towards the front, maybe angled down a little bit. Again, things that you have no control over, but will limit your ability to move in certain positions in certain ways. So when you're looking at squat depth, make sure you find a depth that is comfortable for you. Again, start with that, knowing that you might get more in time, but forcing your body to go to a point that it really can't go, and it's just really uncomfortable, is only gonna make things worse for you, and it's gonna continue to cause knee pain. And if you keep doing it, that knee pain is gonna become hip pain and probably back pain. It's just gonna keep working right up your body. So make sure you find the depth that's right for you. So how do you figure out what's a good squat depth for you? Well, if you're new to squatting, or if you're having knee pain with squatting to some kind of a surface is a no-brainer. You really should be doing it, okay? So I have some steps set up here. If you're at home, you could squat to the couch, the arm of the couch, chair, maybe throw a couple pillows on top to find that right depth or that right height for you, but find something. Don't just, doing sort of a freestanding squat is great, but when you're trying to learn how to do it, having a target really does make a big difference. It does help to make sure that each rep is the same, right? So that you're getting your butt down the same way each time. It also gives you a way to sort of progress or regress, and I'll show you what I mean in a second, but find something, okay? What I typically do when somebody's new to squatting or when I meet somebody for the first time is we sit and we always kind of work from the bottom up because it allows us to set up the position. So I'll show you both from the front, and then I'll also kind of swing over to the side and show you more of a side profile. So again, find a position that's good for you. Set your feet a certain distance apart, right? And then kind of scoot to the edge of your seat, okay? That's important. I want to get to this point so I can get my body forward, okay, to this position. Don't squat like this. Remember we talked about that vertical torso position earlier. I can't stand up like this. So what people tend to do is they throw their body forward and they come up that way. That's a lot of my spine going forward and straightening up. That's no good. So what you want to do is scoot your butt to the forward. And I talked about putting your hands on your legs. Use it in the beginning to help you get used to the technique. Most times when my clients or patients have knee pain and I show them how to do this, they can actually squat without knee pain. So their knees are actually fine. It's how they were doing it that was the issue, right? So what I want you to do is lean forward with your hands on your legs, okay? Think about pushing your heels into the floor, squeeze your butt muscles, and then stand up. And then when you go to sit back down, same thing. Lead with the hips, hands on the legs, come down, and sit. So the key is once you get the hang of that, what I encourage people to do in the beginning is to sit between each rep. So I'm going to do 3 reps and show you what I mean. So I come up on the first one, I come back down, and I sit. I reset into my second rep. Come back down, and I sit. One more time, I come up, and I come back down, and I sit. So if you can do a set of those and there's no knee pain, that's fantastic. The next step is to do what I call a tap and go. This time you're going to come down, you're going to tap your butt to the box and come back up. What this starts to look at is your transition, which we talked about before. Most people's transitions are not very good. So if you can sit and stand with no pain sitting in between each rep, and then you go to come down, I'm going to do a tap and go where I come down and I tap the box and come back up. If that causes pain, then we know your transition is the issue. It's not the squat. It's at that bottom position is where you're losing tension, you're losing control of the motion. So box squatting for depth and for retraining that motion are critical. So start with the sitting between each rep, progress to the tap and go, and see what happens to your symptoms. If they come back, then you just have to work on that transition a little bit more, and it gives you that information so you know that the squat in and of itself is actually fine. It's how you're doing it that was the issue.